Hi everyone, I'm with the very skilled Dr. Sam Jethwa today.
Hi, Rabia.
So Sam, I don't normally start with long introductions. I keep it short, sweet. Everyone knows you're amazing, that's why you're in Denfluence. So we're going to start from your beginning.
Yeah.
Why dentistry? I know that's a basic textbook answer, don't do it. Tell me, go into your childhood, what inspired you?
Because I want to help people. Okay, so that is obviously the classic answer, the classic interview answer. I think really that is an element of it. You can't deny that is something that you get a lot of satisfaction out of. The biggest thing for me was I wanted to do something where I was in control of my environment. So I could brand something the way I wanted to.
Yeah.
I could have control of kind of the aesthetic of where I'm working. And when you're kind of thinking of a career, it's a lot about kind of where you're going to be working that you think about when you're young. You know, if you're thinking of medicine, you're thinking about being in a hospital, and I knew that wasn't my environment. So, or you know, law crossed my mind. Would I be a lawyer? And I was like, I didn't really want to be in that kind of office environment. So dentistry had that kind of blend of the environment I could create to be the way I want it to be. The other thing is that I was creative, but not creative enough to do something purely creative, if that makes sense. So going into like a totally arty subject would have been too much. I'm not creative enough for that. But then dentistry had that kind of blend of creativity and actually doing something that really is making a difference. That was perfect. And also the biggest thing was also the freedom to kind of take your path the way you want it to go. So there were people that I knew who were dentists, my parents' friends, a couple of them were dentists, and they all were kind of doing different things. Also had a neighbour who was a dentist, and I could see that actually you really have a lot of freedom and you can choose what you want to do. And because of that, I thought, right, this is really what I want to do. But there was one moment, which was when I was watching, I think it was 10 Years Younger or something at the time, one of those shows. And they showed the dental bit, and that was when I thought, oh my God, that satisfaction that patient is feeling and the dentist is feeling, that's like priceless.
Yeah.
And that's why I always knew that cosmetic dentistry was where I wanted to go. Or even if it's not just purely cosmetic, it's enough to make a big difference. And I think any dentist, no matter what you're doing, you're making a big enough difference to someone's life.
Yes.
And it is true, even though that's a textbook answer. The days that you leave work and you feel the happiest are the days where you feel like you've really changed somebody's life.
Yeah.
And that, it sounds cheesy, but it is the truth.
Changing lives.
Yeah.
I like it.
So that's probably the long answer.
So you studied dentistry at King's, right?
Yeah.
So what was dental school like for you? Good, bad, ugly?
I loved it.
Yeah?
Yeah, I absolutely loved it. And I still look back on all those years as really fondly.
Yeah.
Because in dentistry you're there for 5 years. So you end up creating these relationships with your peers that are really, really strong. You almost spend nearly a similar amount of time, in your school life. And so the friends that you make are really good mates. And some of the, Simon, who you interviewed last week, is a uni mate of mine. So we're in the same year. And we're still really good friends now.
Yeah.
And there's a lot of people at uni who I'm still really good mates with. I think that's what it's all about. You forget about the learning, you forget about the exams, you forget about all of that stuff. It's the relationships, and it was really good. We had a great time.
Looking back, if you were supposed to give yourself any advice, hindsight's a wonderful thing. Dr. Sam Jethwa, what would you say to yourself, even for dental students looking, like watching?
So I think it was learning the academic side, learning to kind of take control of it yourself. I came from a school that we were sort of spoon-fed. Kind of this is the kind of list of things to learn, what you need in the exam, go and learn it, and fine. And we did that, and everyone did well. Whereas when I got to university, it was like, this is all the information. Now you figure it out.
Yeah.
And that I found quite difficult initially, academically. That's the one thing I remember, that it was quite difficult to kind of make that shift. But once I got that nailed, in the sense of, I need to work a little bit harder than I have been working, then it was fine. And I see a lot of students, you know, through BACD events and other things, a lot of students I do meet, dental students, and they just seem so keen now than I remember myself being with regard to kind of, oh, what courses should I do? What should I do as soon as I qualify? Or like, should I be doing something now? And that's really amazing to see. But at the same time, I kind of remind them that, you know, enjoy it. Because those years you don't really ever get back, and just have a great time. The education will come, and afterwards really get your head down and focus. But while you're at university, just really enjoy it.
So when you came out of dental school, did you find it quite easy to find a job?
No, I didn't, actually. I was really lucky. I had a really, really great VT trainer, and I was all the way in Cornwall, which for me was almost another country.
That is.
Because I'd grown up in London, went to King's, lived in central London during uni, went back home, which is northwest London. So, you know, being told, you get that email that you're being shipped off essentially to Cornwall and you've got nothing to do, nothing to control about how you're going to move to somewhere else. I just ended up going there, and I had the best year. I had a really, really good year. Amazing trainer, made some amazing friends, and really had a good time. And then when I was coming back to London, I felt like I was disadvantaged because I wasn't already in London. I didn't have the connections. I hadn't been to many courses in London. I'd done some stuff in the southwest, but that's not where I wanted to stay, so I hadn't really know anyone. So it was a case of CV dropping. I got my CV ready pretty early. There was nothing on it, you know. I didn't have a portfolio at that stage. I'd started taking photos at about 3 cases that I thought were decent enough. And that's probably the biggest thing I would say to new dentists who are looking for jobs, is create a portfolio. That doesn't have to be perfect, but at least there's some photographic evidence that you're looking to improve as a dentist, and I think that's the most important thing. But finding a job was hard. And then I remember being at the airport at Gatwick, and I was about to take off for my final weekend in Cornwall, and I didn't have a job. I had like a 2-day private job lined up, which, you know, there weren't many patients, and I didn't really know. I was out of my depth. And then someone called me, and he turned out to be a really, really great guy, and I worked with him for a few years, about 4 years, and I still go back to the practice now and then to help out with a few cases. So, you know, sometimes it just works out. I was pretty lucky, I guess.
It's definitely worked out for you because you started your own academy, Bespoke Smile Academy.
Yeah. So we now have our teaching academy, which we have 2 courses. We have a flagship course, which is the 8-day comprehensive course.
I was looking at that.
So what that is I'll tell you how it was born. So essentially, I was going on so many courses, and I was learning about a lot of different things, and I got to the point where I felt like I knew a lot, but I didn't really feel confident enough to kind of see a really complicated case and not freak out. So I then thought, right, what am I taking from these courses? So main thing was occlusion courses. Because we're really not taught that very well at undergrad level.
No, we're not.
You know, we're taught definitions and like kind of that's it.
RCPF.
Yeah, which is like no use really to anyone, right? So what I started doing was going on a couple of occlusion courses and you know, those kind of things. And what I found is every time I went to an occlusion lecture, I'd be more confused. Because one person said that, another person said that, and then I thought, well, what is right? I thought I knew it, and now I've been to another one and now I don't know it. So then I kind of put all those little bits together and thought, right, and put it into practice, and was starting to feel more confident with the cases I was treating. And we kind of got this formula of how occlusion needs to work in practice for aesthetic and functional cases. And then I thought, right, we need to spread the word about this, because this is really quite simple. This is not complicated stuff. And it's just overcomplicated by, I think, the different schools of occlusion. So really what we teach is a bit of everything. We're not kind of married to one academy that's already out there, and it's not kind of our own thing. It's bits of everybody's, and it's kind of what you really need to know. You know, if you see a case that has this wear pattern, this is how you're going to treat it, and why is that pattern there? You know, so diagnose it and know how to treat it, and it's very formulaic. And so that makes it really, really simple. When you have a really complicated case, you just break it down, use the principles, and we can treat it. So really the idea of the training came from that.
Yeah.
And the other thing that I feel really passionate about is that we should be working, we work in a team in dentistry, right? Yeah. So we have our nurse team, we have our TCOs, we have our technicians, and we have ourselves. Yes. And obviously the patient is part of that team. Absolutely. And often that's forgotten about. They're just a mouth. Now, what I was finding when I was seeing more and more complex cases, and when I say complex cases, I mean more complex patients, management-wise, because that's what keeps us up at night, not whether that crown's going to stick. It's like the patient. So I started to see a lot of cases that were quite complex in that way. Yeah. And I thought, right, we need to find a way of getting them to be involved in their kind of treatment, basically. Yeah. So we produce something called a trial smile. Yeah. So if you've seen on the makeovers on Instagram and things, we do an interim stage, which is the trial smile. And that trial smile allows the patient to give their input into what it's going to look like. And that's really, really important. So we create it in the surgery by hand using flowable composite and things like that. And then they live with that. And that's a set of diagnostic temporaries, basically. Yes. And then they come back and they tell us what they like and don't like and what their individual needs are.
That's what makes it bespoke.
That's what makes it bespoke. That's where the name came from. Okay. So that whole process really puts the patients in a bit of control in the sense of the aesthetic.
I think it reduces, and it's important as well.
Yeah, it definitely does, because it means that you're not relying on anyone else to design the teeth. And you know, if you're a cosmetic dentist, you're calling yourself a cosmetic dentist, you've got to know how to shape a tooth. Yeah. Right? So that's what I really want to teach. I want to show people how it is straightforward to actually, if you have a formula of how you're going to design the smile, you can design a smile in the surgery for the patient, and they can live with that. You don't have to rely on a wax up. No. You don't have to rely on your technician. And also therefore your patients are going to enjoy their case more because they're more involved. The results are going to be better. And then training the technicians to copy your trial smile is the other challenge. So
the whole team involved, basically.
Yeah, and then everyone's involved at every stage, but the people that are making the decisions are the patient and the dentist. Yeah. The technicians are working for us to create that result, rather than traditionally where you send off the work, they produce something and then you fit it, right? Yeah. There's no ability to know if that's going to look right. Yeah. There's no ability to know if it's going to function right. So that's kind of the process, and that's what we teach. So
what about people who might think that you're too young to teach, you know, like, you know,
yeah, I guess, you know, I think the only people that can answer that are people who've done the course. Yeah. If they feel like they've got enough out of it that they set out to get, then you know, that's all that I would want to kind of respond to that with. Yeah. I mean, when some patients say, "Oh, you look really young to be doing this," and I just say thank you, because you know, that's a great compliment.
That is.
Yeah, I'm sure it will die down soon enough, and people will stop calling me young. But
you get a few grey hairs, and then
a few. It's already loads. So you know, I think that if there is enough knowledge to part on, then actually, yeah, you know, and if you are trained enough to be able to teach effectively, I have done a postgraduate diploma in clinical education, all that sort of thing, then it gives you the skills to go off and teach. So yeah, I don't think age is a factor. Yeah.
Now with aesthetic dentistry, we're talking about complaints.
Yes.
So why do you think there are so many complaints in dentistry? Have you had one yourself? Over?
Yeah, I mean, everyone's had a complaint, right? We should never be embarrassed by the fact that we've had complaints. Yeah. Essentially, you're dealing with people, and people are not always happy. No. I think that I used to deal with complaints really badly before, and then I started obviously treating slightly more advanced cases, and I started to change the way I dealt with it. Yeah. I think that we just need to remember that usually the patients are not happy because of something really quite small and insignificant. Yeah. And it's really easy for us to put it right. Okay. In the sense that if someone calls you and says, "I'm really unhappy because of this," instead of fighting it, just agree and say, "You know what? Actually, yeah, you have a point. maybe you're right, you know, I can see what you're saying, I can understand what you're saying. As soon as you respond with something like that, then suddenly the tension levels reduce. If it's oh no, but we did this, and oh no, but we did that, and actually no, I don't think that's right, I know I did everything correctly. And that's a natural response, right? You want to defend what you did, because you don't go out to deliberately do something badly. No. And if they feel it's not been done well or whatever it is, then you feel defensive. But actually just remembering before you get into that defensive mode, just going back and saying, actually, maybe you're right. Why don't you come in, let's have a look at it, let's talk about it, and I'll figure out a solution no matter what it is.
Some are justified, but some complaints are unjustified. Why do you think dentistry has such a litigious nature?
I think it's all that no win, no fee stuff started, and then also the adverts didn't help, you know, from various companies and things like that. I think what we have to remember is that it's actually quite similar across the board with many professions, and it feels like kind of a violation of your kind of professional responsibility. You're doing the right thing, and actually, what the hell? How can they do that to you? I think you've got to remember that it's probably not personal. It's born out of something else that's going on. And I had a complaint a few years ago now. Literally, it was a deliberate attempt to, you know, to create a problem. Not personal. And I was actually told, this is not personal. This is not about you. But I need to do this to, you know, whatever.
Oh, wow.
So those kind of things happen, and it's really hard. It's really hard to deal with. But we have indemnities, you have insurances and stuff like that. I think as long as you try to be really nice to every patient, keep everybody as happy as you possibly can, do the right thing, don't be out of your depth and attempt things that are heroic. Be really upfront with patients. One of the things when I was younger, I know maybe people consider me still young, but when I was younger, I would sometimes be almost bullied into treatment by patients. Because patients say, oh no, but can you please try and save it? Can you please, go, why? I really don't want to lose it, whatever it is. And you feel bad, and you say, oh, okay, go on then. And sometimes it backfires, and quite often it backfires, and you knew it wasn't going to work. And then you said to them, but I told you it wasn't going to work. And so, well, if you knew it wasn't going to, why did you do it? And you said, well, you tasked me to, well, you're the dentist. You know, this conversation, I'm sure so many of us have had. And we should never be bullied into treatment by patients, right? If somebody wants something, if you don't think it's the right thing, you shouldn't do it. And it's as simple as that. And if we don't get bullied into stuff by patients, then we'll probably end up sleeping better at night. And in the end, you're helping them by doing the right thing.
Because there's dentists out there that are capable of doing certain treatments, or they learn new treatments, but they're too scared to do it because they think, oh, I'm going to be sued.
I think, you know, if there's something you've learnt, you've got to put it into practice. Otherwise, you lose it, right? So with our course, for example, we do it really intense. It's like 4 weekends over about 3 months. Because you've got to just learn. It's got to be fresh, and you've got to go out into your practice on Monday and do it. So I think with dentists going on courses, you've got to go and do it straight away. But if you have a funny feeling that the patient isn't the right patient to do that on, then don't do it.
Case selection.
But also remember that patients are also sometimes really, really impressed, or they're more sort of surprised in a positive way if you offer them something and say, look, I've been on a course, I've learnt this, would you mind if I try this technique? You know, it may work, it may not work, but this is something that I really think you could benefit from, and would you mind if I give it a go? Maybe book it at the end of the day, have a bit longer, ask your nurse to stay, and then try it out. And patients like that sort of thing. When I was going on courses and doing, and I still do now, I say to patients, I've tried this I've got this new technique, what do you think? And they really enjoy that, and they think, yeah, that's a great thing, why not? So I think we need to not assume that patients expect us to know everything. They actually value the fact that you're going and learning more. So it should not be something to be ashamed of.
So I found you on social media. So you're like a social media star. So you've got over 16,000 followers now?
Something like that, yeah.
So how did you grow that platform, and what do you use it for?
Yeah, that's a really interesting question. I mean, the how is really difficult to do. So it kind of happened by accident. I thought, okay, Instagram is there. It's a free thing to use. And I was actually quite late to the Instagram, like from a personal perspective, I was quite late. My friends had it. They were like, Sam, why are you not Instagram? You'd like love it. It's like made for you. And I was like, really? And I was like, no, I don't want it. I don't want it. It's just another app, you know.
Yeah.
And then I got it, and I started using it. And then when I started seeing more cosmetic patients, it's a really visual thing, right?
Yeah.
So like I saw on TV, and it was like, this is what I want to do.
Yeah.
I thought, okay, this is a good platform.
Yes.
And I had a case, I think, initially that I was just a bit proud of.
Yeah.
And I thought, I really like this case. And I didn't post it for weeks and weeks and weeks because I was scared of, not good enough.
Yeah.
So this not good enough thing is, for dentists specifically, the first thing to remember is that it's never good enough. And as long as you accept that, I look at my cases and I still pick them apart all the time, right? And next time you want to do even better.
Yes.
And that's a good thing. So if you're feeling that, that's a good thing. Okay. The other thing is that people putting out really good work is actually driving standards up. So if you're seeing stuff that's better, and you think, oh, yours isn't good enough, okay, accept that maybe you think yours isn't good enough, and you can then see so much available on Instagram and on social media that will help you to kind of improve.
So you think, inspire yourself, don't be demotivated.
Yeah, totally. See the other stuff and think, okay, that's amazing. How do I learn how to do that? Or like, you know, maybe I'll try and shape my teeth this way or that way. And it's driving standards up in a way, which is a good thing, you know. There are still some things that we see, you know, which we might not like. But ultimately, I think if you're starting out on the kind of social media thing, I think you've got to just, that first hurdle of not being too afraid and just accepting, look, it's not going to be as good as some other person's or whatever it is, but put it out there. And people are not there really to kind of bash you down. They're there to support. And I'm sure from the people you've spoken to and some people who I'm friends with in that kind of group, we kind of all support each other. You know, we're all doing the same thing. We're all kind of trying to push standards up. We're trying to promote good dentistry, and we're all in it together.
What about those that aren't? Well, have you experienced it yourself? Any bashing?
Yeah, I get like the odd message here and there, and you know, initially, like anything, it kind of upsets you. But I think that everyone's got an opinion, everyone has a right to an opinion. If you're going to put it out on social media, this is the point. It's like you need to know to accept that. But at the same time, you need to kind of grow a bit of a thick skin. It's not nice. I think the main thing, if you're going to put stuff out on social media, is to grow a bit of a thick skin and accept that if you're going to put yourself out there, you know, you are going to invite maybe a little bit of negativity, just like there is with anything. But at the same time, if you really do want to grow that platform, you're going to have to. It's usually something that you should, I think my advice would be not to dwell on it. Sometimes the cases and people that comment, they themselves are not putting something out there. So, you know, if they can't handle it back, so like, you know, does it matter that much? The other thing is also, like I said, sometimes the patients are in control of the aesthetic of the case, right? So sometimes maybe it's too white for someone's liking, or it's too square for someone's liking. It's like, oh, it should be like this. Well, you know, it's the patient that's living with that smile, and sometimes they've asked for those things. And so you may see in my comments when I will say, make it very, very clear, patient has asked for this, because before there's a backlash of people that may not like that style. You know, we've all got our own style. And you'll see the cases that I post are very different. A lot of them are very, very different. They're not all looking the same. And the reason is because, you know, it's got to look right for each patient. So everyone's got their own opinions, and I think don't let it get you down. It should never be a negative. In fact, also don't kind of shy away from it. I know that sometimes you might receive a message, but you know, sometimes all they're asking is a simple question. Just reply with an answer, and usually they'll kind of respect that. Not that you have to kind of put up with anything that's negative. I would just try and compartmentalize it in the brain and put it aside.
With having a social media account, running an academy, being a dentist, obviously you've got your own personal life. How do you juggle it all and not get burnout? What's your secret?
there's no secret. You do sometimes get really tired. You know, I think it's all about routine. And I'm very, very regimented with my routines. And also, I think the biggest thing, when I started to take on so much more and do so much more all at once, I found that the biggest problem was your massive to-do list, right? And it just keeps getting longer and longer and longer and longer and longer. So the only way is to prioritize according to urgent, can wait, right? And then do it that way.
Video on this.
Yeah.
The funnel thing.
Yeah, totally. And that really did change the way I managed my time. So, you know, you have the routine every morning, checking these things. Like I wake up, and obviously the first thing I do is check my phone.
Yes, I think
right? And I will go through and I'll do things in order. So I'll do emails first, I'll do WhatsApps next, and then I'll do social media right at the end before I leave. And then at work, you kind of get into the habit of multitasking and doing bits of this and bits of that. And then at the end of the day, I'll always have my priority list of urgent, less urgent, and go that way. That's the only way. So but yeah.
Young dentists, what would be your 3 kind of short, quick tips for them?
I think that number one thing is focus on investing in yourself.
Yes.
Education is the most important thing.
Absolutely.
The few years of dental school, let's say if you get your head down and keep educating yourself for 5 years after, in those 5 years after, you'll learn more than you've learned in the 5 years at undergrad. And that's the number one thing. Don't wait. Just, you know, what are you waiting for? Get those good habits in from day one. Number 2, don't feel pressurized by social media. In the sense of you don't have to have an Instagram account, a professional one, if you don't want it. You know, it's not an absolute necessity. Patients still find you, and if you're good, you'll get word of mouth referrals. Like, it's not all about Instagram. And the other thing is enjoy it. I think, you know, people feel really demoralized in dentistry. There's a lot of people that feel really demoralized, and I think that the only person that can change that is you. And people say to me, you know, why? Oh, you just love it. That's why you do all this, because you just love it so much. Yeah, okay, I love it, but maybe there's a reason why I love it. I love it because I threw myself into it and didn't stop really. And now I've turned it into something that I love. Maybe if I hadn't done that, I'd hate it too. Never be afraid of the price of a course. It's the value you're going to get out of it. Do it, you know. Those kind of things will keep things ticking over, and building a good network, joining academies and making friends in the profession.
There was actually something I wanted to ask you earlier on. So you've created an amazing academy to teach postgraduate education. But do you think there's a problem with dental education? Because more and more young dentists are coming out feeling underqualified, not confident to do basic treatments.
I think, you know, seeing what I've heard from what's happening now, the number of kind of quotas you have are reduced, right? So some people come out of dental school. 5 fillings. 8 root canals. It's ridiculous. So I think VT year is probably really key for that.
That's what you learn.
Yeah, because you're thrown into this environment, and you probably remember when you have like 3 hours to do one filling, and then they say, oh, when you're in practice, you'll have 15 minutes to do that filling. You're like, no, it can't possibly be, you know, and you end up like working faster, and it happens. And so if you feel that there's a lack of education, kind of clinical education and clinical experience, then I think going on hands-on courses are good. If you feel like that's a bit that's lacking.
Do you think dental school needs to be changed? Something in the curriculum needs to be addressed? People should be coming out confident. It's 5 years long.
I think that it's a career that is always developing, and there's always gaps in your confidence. So I think also that's normal. People shouldn't be overwhelmed by that. Maybe they do need to think about how many patients you see undergrad. I remember seeing a lot of patients undergrad, but you know, I qualified in 2012, so it's changed probably since then. But I think it's normal to feel lacking in confidence. Just go out there and do it, and you know, you'll get better. And learn and go on courses and join an academy that you feel you're interested in. You know, if it's implants, join an implant academy. If it's cosmetic dentistry, join a cosmetic one. Surround yourself with people who are doing the type of dentistry that you want to do, And through that, your confidence will grow.
Yes.
You'll feel better about everything.
One word that comes to mind when I say life.
Family.
Career.
Progression.
Money.
Not equals happiness.
Patience.
Value them.
Okay. Alternative career option.
My dream career is to be an architect.
Nice. It works. Define success in one word.
Contentment.
Worst experience or day in dental school? No. Summarized.
Worst experience, when my clinical partner had to give me an ID block.
Oh, yeah, mine was shaking. I hope she's not watching this.
And when I dropped a patient's 3-unit bridge down the sink on the 21st floor of Guy's Hospital.
Oh, man.
Yeah, we had to get the plumbing involved. It was really horrendous. Fitted like a dream afterwards, though.
The same one?
Yeah.
Maybe that's the trick. Just chuck them down the sink and then take them out.
Disinfected, of course.
Of course. The weirdest DM on your social media page?
Oh, God. I mean, you get sent a lot of nudes, don't you?
Do you?
Yeah. Like weird Russian ones and
That
stuff.
didn't happen to me. Thank God. Don't do that.
Should we cut that out?
No, keep that in there. That's the best answer we've had to weirdest DM. Okay. An inspirational quote that pops to mind.
Set trends, don't follow them.
I like it. Cool.
That's me there.
That's you?
Yeah.
Okay, fine. That's like your
My
byline.
quote.
Cool. All right. Worst quality.
Worst quality. It's so cliched, but just taking so much on. It's just that is the worst quality, and possibly then therefore not giving as much attention to other parts of my life that I should.
Your greatest achievement.
I have a really supportive wife and family,
Yeah.
and I think that if that part is not there,
Yeah.
then everything else crumbles. So
So cute.
yeah.
Your spirit animal.
Ooh, a sausage dog. I'm obsessed with them.
Everybody says sausage. I was like,
They're so cute.
that's after the animal dies. Okay. So your.
Do you not think I would look a bit like a sausage dog?
No, I wouldn't have put it there.
They're really cute.
Yeah.
All right. Last thing that made you really laugh.
Something that happened in this interview.
Oh, that's true. Fine, clever guy. I'm hilarious. My husband and my family don't think I'm funny, but I'm funny.
They do, they just don't want you to know they do.
He's my favourite now. A memorable patient journey.
Yeah, okay. So there's obviously been so many,
Yes.
and knowing which one to pick is difficult.
He loves you all.
Yeah, I do. But I'll just do a general thing in the sense that we see patients who have not been to the dentist for years,
Yeah.
do not smile, literally walk around like this. And just seeing them kind of at the end is just amazing. And I remember this one patient who was in tears, during having a look at it and that kind of thing. And when she came back 6 months later, she was totally, her whole demeanour was different, She was speaking differently, she had her hair done differently, she was wearing different clothes, she was walking with confidence. And it's like, what happened to you? She goes, I had my smile done, And that's what it's all about.
Changing lives. See, we save more lives than doctors. All right. Who inspires you?
Who inspires me? My wonderful nurse Sophie, who is waving behind.
Zoom in, close up. Oh, look at that smile.
Who I could not do what I do without,
Yes.
of course. Who inspires me? I think there's always people that will inspire.
Yeah.
I think, though, the most important thing is focusing on yourself and making sure that you're happy with what you're doing.
Yeah.
When I tried to kind of copy people,
Yeah.
initially, when I had mentors and I tried to be like them,
Yeah.
it never really worked because I'm not them.
Yeah.
I think feeling comfortable in your own skin, finding your own vibe and finding your own aesthetic and your own kind of goals, that's really when the confidence comes
Setting
in.
your trend, right?
Setting the trends,
That's
not
it.
following
I
them.
like it. Now, who do you nominate for the next Denfluence?
I have to nominate with the other big quiff in dentistry.
The other big quiff? I thought there was only one quiff.
No, there is really, but there's another one as well.
Fake
Minesh Patel.
Minesh Patel.
And tell Minesh not to wear this same jacket that he's just bought.
So you've been nominated, Minesh. He's a hard man to get a hold of.
Yeah, I know. He's another one that cannot say no and takes too much on. So I'll help you. We'll nail him.
Got it.
Yeah.
Got him. Love it. Thank you so much, Sam, for your time.
It's a pleasure.
Valuable. Thank you so much.
No, thanks for having me.